Okay, I'm going to hop on here really quick to talk about an executive order that came down from Abbott. So, without further ado, I'm going to let you know all about it, what it is, how it affects marginalized communities, in particular children and immigrants, as well as LGBT individuals. And then we are going to talk about what to do about it, the implications of it, and how you and I, as allies, can resist it so that folks aren't hurt. So, sorry if this looks a little bit, not whatever polished and all that good stuff. But stay tuned because this is really important information. And at the end, we're going to talk about ways to fight back that might be safer for people like you and I who have a place of privilege, being white, cisgender, all of that, and how we can not obey in advance. Just to be clear, I'm going to put all of these articles in the description so that you can go find the original sources yourself and read for yourself and inform yourself. However, the Children's Defense.org posted a new Texas executive order requires hospitals to ask about immigrant status. And here's a little bit more about that. So Executive Order G846 was signed by Governor Abbott in Texas and it became effective on November 1st. This order mandates that the Health and Human Services Commission, HHSC, directs Texas hospitals to collect information about patients' immigration status and report this aggregate data along with the costs of care provided to undocumented patients to HHSC quarterly. Now, what's also terrifying, where does this go from here, is that beginning January 1st of 2026, they must also provide annual reports to state leaders detailing the costs of inpatient and emergency care for patients who are not lawfully present in the United States. So that the facilities subject to this order are public hospitals and acute care facilities that accept Medicaid or CHIP funding. So that CHIP in Texas, CHIP is children, right? So Medicaid and CHIP only goes to the most impoverished people in the state. These are the people least likely to fight back. These are the most marginalized, vulnerable people, minors, children, all of that. Okay. Texas is home to more than 1 million U.S. citizen children who live with at least one undocumented family member. 1 million children live just in the state, live with an undocumented family member. There's going to be consequences to this, potential deportation. This is all just about leading up to mass deportations, right? Like we know this is where this is going. So what can we do instead? Let me tell you a little story because this is going to be really helpful in contextualizing how you can fight back in a way that's actually really not confrontational. Because let's also be clear that when we're in that environment, the people that are asking those questions, they're just an admin, right? This is just a person doing their job, right? They're not out here trying to oppress people. I mean, maybe they are, but for the most part, right? They just got a job to do. So how do we navigate in this new world we find ourselves in? So many years ago, I was working with a lot of eating disorder patients. And one of the things that I became aware of is how every time you go to the doctor, whether it's related or beneficial to your care or not, they would weigh you. Now, I had a lot of clients where getting weighed was deeply, deeply triggering for their eating disorder. And there was no consent obtained or questions, nothing eating disorder oriented in how the practices of being weighed at the doctor played out with a particular individual. What I started saying was, no, thanks. I didn't make it a big deal, but if I'm going to get a pap smear, they don't need to know my weight. It's the same weight as last year. They're not giving me any medication. There is literally nothing about my weight that is going to inform their medical decision making. So I would go into the doctor. They're like, oh, get on the scale. I said, no, thanks. I don't do that anymore. And I kept walking. And she looked a little bit confused. And so I was like, hey, which room do I go to? And she guided me in. And, she was fairly uncomfortable. And so what I said was, hey, if you need a general weight for my documentation, it's the same as last year. We just kind of moved on, right? So it wasn't a big thing. Now, I'm not anymore in a larger body, although I did spend the majority of my adult life in a larger body. And so I'm not in a larger body anymore. But it's really, really important for those of us who are not impacted necessarily by that practice to also engage in this pushback, right? It normalizes it. I have that philosophy because when I was in grad school, I would ask people that came to speak with us about particular topics, how can white people be strong allies for a variety of marginalized communities? And every time their response was leverage your privilege. So, as a white, cisgender, hetero appearing woman, I push back because when we all push back, then it alleviates some of the burden from the marginalized or the oppressed, vulnerable people. And it allows them to not have to do as much work. And it puts the responsibility on us who can do the work, right? The consequences to us doing the work will be far, far less than those individuals who are oppressed, marginalized, and vulnerable. Okay, so how can all of us respond? Is Timothy Snyder, in his book on tyranny, promotes the concept of do not obey in advance. So what he's talking about is we all kind of go on autopilot. And how many places have you gone to where they ask your demographic status? They ask demographic questions. Well, if we're just on autopilot in this new world order we find ourselves in, we'll just continue in habit to answer those questions. I'm asking you to stop doing that. So, as a practice, my group practice, we no longer ask demographic information related to immigration status, ethnicity, race, gender, pronouns, LGBT status, none of that. I get in none of that information because it is irrelevant to the work that I do with clients and patients. There's a couple things you can say. One is if you are asked about your immigration status, same with gender, same, like it applies to all of it. Gender, LGBT status, race, all of it. You can say, I'm not comfortable sharing that information at this time. You can say, I prefer not to disclose my immigration status. You could also say, I prefer not to disclose any demographic information about me. You can say, I'm here for treatment and would like to focus on my health concerns. You can ask clarifying questions like, can you explain why this information is necessary for my care? That is a similar thing, actually, that I did with my own doctor who wanted me to get a particular vaccine and I was on the fence about. And I said, I'm open to hearing that it's important for me to do this, but I'm going to need a really, really good argument as to why. And he gave me one and I did it. You're leaving the door open to working with them, right? You're leaving the door open to providing that information as long as it's really valid and is relevant to what you're doing here. Some potential consequences of declining to answer these questions. One to know is you cannot be denied in this country. It is federally protected for hospitals to provide emergency treatment under federal law, regardless of your response. It can also create some potential tension by declining that, like in that situation that I had with the admin. He wanted to take my weight. She was a little uncomfortable, but I just kind of started joking around and smoothing things over and offering compassion for she's got a job to do and how can I make her life a little easier. And that really seemed to calm down the discomfort that I was feeling from her. But be aware, declining could create discomfort or affect the trust between a patient and the provider. Here is the last piece that is my absolute favorite is the facility might note the refusal, but it will only affect non-emergency data collection. And here's why I love it. I have a Master of Science degree, and so I really understand how important data is in making decisions. If all of us collectively stop answering this question, we will mess up their data and they will not have enough information to make a decision with. So, this is a way that all of us can, in small ways, disobey in advance. Okay. This is how we start doing the work of pushing against authoritarianism in our day to day life. One piece is, how do we define an emergency, right? So if you're going to a hospital and you have a fever or a stomach ache, or potentially that could extend to like a broken arm, that may not be defined as an emergency and receive those emergency care protections. So this is like imminent heart attack, something really, truly emergent. So if you are concerned about your immigration status, make sure that what you're going for is truly an emergency. Don't go if you're having a panic attack. Don't go if you're hyperventilating, right? So really know that the definition of emergency may be open to different interpretation. So take a deep breath. There is a lot we can do. I think we all need to go read Timothy Snyder's work on tyranny. He's written a few books about it. Let's get informed. Ask yourself, if I were a German, a non-Hitler supporting German in the 40s, 30s, actually 20s, 30s, and 40s, how would I have behaved? What would I have done? And do that. If I were a Southerner and an anti-slave supporter in the South, what would I have done? And do that, because that is where we're at right now. There's a lot we can do, y'all, but we got to stay present. We got to stay focused. If you're having a hard time, please go see a therapist. Please get support. Band together. You know, during the height of the pandemic, I had a lot of clients who created pods of safety. So they had like groups of people. They would hang out, make your own pod now. My practice is going to be offering some free services to LGBT individuals because that's what I can do. Making videos, that is what I can do. Take a deep breath. Rest. Recover. Do what you can. Every day is a new day. And we're going to get through it. But it starts with being present, thoughtful, and deciding how I want to respond instead of reacting or being on autopilot. All right. Till next time.